Hello, everyone.
Hey, George.
Can you hear me, Nick?
Yes, sir.
Trying to get ready to open here. Are we live yet?
Yes, we are.
We are live. Perfect timing too. We're just we're going to call the meeting to order at 7 o'clock. Tonight we have actually, Larry, do we have, just so I have some visibility, do we have anybody from the public logged on?
Not at the moment, no.
Okay, excellent. All right, so just do a quick roll call here. We have Councilman David Huberman, Councilwoman Lisa Shanahan, Councilman Tom Keegan, and Councilman George Serenides, and Councilwoman Dominique Johnson. And Councilman Manny Langella is just signing on. Manny, you there? You're muted, but I see you. So we do have a quorum. The approval of the February 27th minutes. Would anybody like to move that?
Also move.
All right. Any corrections, discussions, omissions? All right. All in favor?
Aye.
Aye.
And any opposed? Abstentions? Looks like it's unanimous. Public participation. Larry, I don't think, has anyone joined in the past 20 seconds?
No, they haven't.
All right. I guess we could go right into new business. This is our first meeting through Zoom of the Public Safety meeting, Public Safety Committee. Obviously, the key contributors to this committee have been very, very busy over the past couple months. So I'm very grateful that they were able to connect with us tonight. They have some talking points around the city reopening plan. I suggested earlier in the call that this be just a bit of a panel discussion. So we're going to unmute everybody and they could just kind of flow between each other just to make sure that there's some continuity. And I think there was a request that actually Nick was to start. Is that okay? Or Deanna, did you want to start?
Sure, I'll just say a quick few words. Good evening, everyone. So as you all know, the mayor has his reopening plan that has several different phases as part of it. And they coincide with the governor's reopen plan and his phases. And so our reopen phase 1 started last week on May 20th. And a big component of that plan is related to recreation and parks, which is why we've asked Nick Roberts to be here this evening to go over and highlight some of that within phase 1. So with that, Nick, I pass it on to you.
Sure. Good evening, everyone. I'm happy to report that with the exception of Cranberry Park, the rest of the park system remained open for residents for walking, jogging, running, passive activities from the very beginning of the outbreak. Considering the importance of physical and more importantly, mental wellness during these times, I think that was the right decision to make. And it was a positive for residents to be able to get out and have a place to go and to actually find some peace. Saying that, we have limited and will continue to restrict the use of certain amenities, which can increase issues and concerns with regards to social distancing protocols. That conservative approach is reflected in the city's reopening plan, which is available online. I'm not going to go into every single detail or item on the plan. But again, I want to reemphasize this is a slow and phased reopening, which was strategically put in place to limit all-day visits and overcrowding at some of our facilities. I'll go over some of the highlights, like I mentioned, the major points as it relates to parks, beaches, recreational amenities, and answer any questions you may have at the end. During phase 1, which went into effect May 20th, since then, we have reopened all of our facilities to both pedestrian and vehicle access, including the beach. Our boat ramps at the marina at Vets are opened with limited hours. The gardens at Photo Farm and the Oak Hills Golf Course are also open. We have restricted non-residents parking at the beach and also reduced the capacity of the overall parking lots of a lot of our facilities during this first phase. And again, the goal of that was to limit the amount of people and the extent and the duration of the time that they're spending there. Again, those are things that were done strategically to limit the crowds and the amount of people congregating in a lot of these areas. Bathrooms, playgrounds, picnic tables, grills, courts, athletic fields are still restricted in these phases. Many of the amenities are high touch and high usage areas. So we wanted to reduce, again, the places where people will congregate, plus acquiring PPE for staff, cleaning supplies, paper products remains a challenge for us. Everyone's looking for the same exact things and they're scarce. We have placed portable restrooms at the beach, Cranberry, and Vets Park, and they're being currently serviced by a vendor. One of the reasons why we did that is that company is able to restock all of those items. And again, we did that strategically to try to limit how much time people would spend at these locations. All concerts, events, programs, reservations have been postponed indefinitely to ensure compliance with the governor's executive order of limiting gatherings to no more than 5 people. And this includes our summer concerts, the fireworks show, Nice Festival, Oyster Festival just recently canceled as well. So there'll be no large events this summer, and there's a slow approach to reopening everything. I think one of the things that the residents have been complaining about is just because we're reopened, that they expect everything to be back at its normal condition, and it's not so. This is a slow approach. We will eventually get there, but we're trying to put measures in place to safely do that. Phase 2, which potentially goes into effect around June 20th or on or around that time, you can expect the following things or the following restrictions to be lifted as well. Lifeguards will be on duty on the weekends at the beach. Right now, there is no swimming or fishing at the beach. Parking capacity will increase to 75% in some areas. That's not including the beach at this time. Athletic courts and fields will be reopened to individual sports and activities. Individual play, singles on tennis courts, no more than 3 people with their own ball at the basketball courts. Some of those things are all defined in the reopening plan. And again, we didn't want to open certain things. Like we didn't want to just open tennis courts, even though it is permitted under the governor's guidelines, and not open basketball courts. Those type of things make it hard for us to do enforcement. And we just didn't want to overcomplicate it. So we've just held off on all athletic courts and fields until a later phase in the reopening plan. Also, summer camps are still to be determined. We were anticipating reopening or having our camps start June 29th. But again, given the circumstances that we're under, given the guidelines that were recently issued by the state, given the fact that the school board hasn't made a decision on summer school, which impacts the space available to us, the decision on summer camp is still up in the air. We have not made a determination on that. We should have an answer in probably another week or so. Phase 3, again, that's the majority of the systems already open. And then as we get to 3 and 4, we're getting back up to our normal operating levels. So phase 3 will have increased parking capacity, expanded operational hours and service, restrooms, gatherings of group sizes permitted by the governor's order, whether that's 50 or 100, we'll certainly follow those guidelines. And then phase 4 is when we're restored to our normal operating levels. So we'll have full service hours, so all amenities will be open. We'll restart our programs and activities, and then we'll also do our events and our reservations. So that's all of those items are outlined in the reopening plan. But I also want to mention that we've also added measures for staff to protect staff in our workforce. Originally, they were split into 2 different teams and they were alternating weeks, but we had to put those teams back together in order to be able to open and operate at our normal levels. So with doing that, we've tried to identify and place staff members in the same vehicle every day and not share those vehicles, to also disinfect those vehicles at the end of the day. Of course, make sure they have the proper PPE equipment. And those things have worked. We have not had any staff members get sick through the duration of this event. And we're also working with our colleagues in the other departments in fire and PD as well. The biggest thing about this plan is having the communication with the public, with staff, and also the enforcement. The enforcement is key in this whole thing. And we've tried to put enough signage out at our high use areas. We've pushed out press releases, updates. We've made sure and be aware of all of the comments and feedback that's going on social media, and being responsive to some of the questions and concerns that are being raised there and online. And we're also working with PD, like I said, on a weekly basis. We touch base, we identify the hot spots, we work out where police officers are needed for enforcement, and they've been a big help. And of course, fire department has also helped us out with PPE and getting us face masks for staff and all those types of things. So it's been a group effort to sort of get everything in place. Everything has worked well so far. Last weekend was Memorial Day weekend. The weather definitely helped a lot, but we didn't have any major incidences. We are not allowing, we're restricting non-resident parking at the beach to 50 spots per day. We did have some people that violated that, and we were quick to make sure and tow right away. I think last weekend we had about 14 vehicles that were towed, and we want to be heavy-handed, and we want to show that presence early on in the season, so that way it sets the tone for the rest of the summer. And I think that's really working. We haven't seen any major incidences. And I think that's sort of the reasoning and the rationale of how we came about putting the plan together. And I get it. Not everyone's happy with it. Everyone thinks that we should get back immediately to how things were, but we will eventually get there. And I think we're doing it in the right way.
Excellent, thank you. And any questions for Nick?
Councilman Langella. Not so much a question, just want to say thank you, Nick, for those plans. I know I've had a few people in South Norwalk reach out to me just in regards to, as people start to re-enter the workforce potentially, and, schools being canceled for the rest of the year, there's just been some dialogue around the summer camp program. So it's good to hear that you're already on that. So thank you so much. And then just keep us posted there too.
Will do.
Thank you. Anybody else? Dominique?
Thanks, Chairman Sacchinelli. Nick. I want to thank you too, Nick. I can only imagine what it's been like to try to keep all of our parks open so people can use them, and the logistics that go into that. So thank you. I did see, especially in the briefing today from the mayor, that we've had some issues with folks coming through parks, particularly to take the tape down from playgrounds.
Yep.
Is there anything about that you'd like us to know, or things we can do to share with residents about that?
Well, I think to continue to push the messaging out there that those amenities are closed. And again, there's a reason why they're closed. They're high touch areas where a lot of kids may not have the same awareness as far as what they're touching and cleaning their hands right away. And that's where a lot of germs can spread. Those were one of the first amenities. Playgrounds was one of the first amenities we closed for that particular reason. And even though we've taped off a lot of the amenities, I get it. It's getting warmer. People want to get out the house. So yes, we are seeing some of those incidences. I'd say continue to remind residents that those things are off limits right now, but in a couple of weeks, they will slowly open up as we continue to progress through the reopening plan.
Thank you very much.
No problem.
Any other questions? Mr. Human?
Chairman Sacchinelli, thank you. Just a quick a thank you, first of all, Nick. Fantastic work that you guys have been doing. A question going back to the summer camps. Are the summer camps, does that hinge on Norwalk Public Schools decision, or are you able to, is it possible that some of the camps can be open, or do we have an answer either way yet?
They don't necessarily hinge on what the school board does, but since the parks program operate within the school space, we want to be consistent with whatever measures that they put in place, that we are also following the same guidelines. And I think we also want to remain consistent. It's going to be kind of weird for schools to close and not be safe to put kids in the classroom, but you do it for a summer camp program. So while it doesn't necessarily hinge on what NPS does, I think we want to remain consistent in our approach as a city to this whole issue. And I think we should have an answer probably in the next week or so in regards to both of those items, summer school and summer camp.
Thank you.
Any other questions? Nick, thank you. That was a good presentation. It was. We appreciate the updates. That's obviously the parks and the parks department and the camps are on top of mind for a lot of people as we're getting into the summer months. So we appreciate everything you've been doing. So thank you. And I think that's the consent of the committee, but I think that's also, I know you hear it's a thankless position at this point in time, right? And you hear the negative more than the positive.
Yes.
But I think there's an overwhelming majority that's very grateful for how you've been handling this with your team there. So thank you.
I appreciate it. Thank you all.
Thank you. Was there additional presentation for the reopen plan, Deanna, or were we going to move on to the?
No, I could just briefly mention that, City Hall and other offices, they will remain closed to the public until phase 3, and phase 3 will be by appointment only. And we're still really encouraging remote work and staggering shifts and, all of those measures right now for where we are.
All right. If there's no further questions on that, we'll move on to item B, COVID-19 updates, starting with the health department.
Sure. So we continue to monitor the cases and report out every day of the positive cases as well as the deaths. And so our latest number is 1,997, so just under 2,000 positive cases in Norwalk. There were 10 more reported today than yesterday, and then a total of 130 residents who have died from COVID-19. And so we continue to look at the data, look at it, on weekly to see the cases, and we do continue to see the cases trending down now. But it is something we're continuing to follow very closely, especially now as we start the reopening process. It's really important to monitor them so we can see what's going on and if it's having an impact, and to make sure that we were able to follow up and keep these cases down in the community. So that work continues. I also wanted to give just some highlights of some of the activities and work that staff have been doing. But first, I want to start with our emergency response team, which are the volunteers that are just incredible people, incredible resource in our community. And they've been working with Glenn Iannico, our preparedness coordinator, and Donna Schlegel is our volunteer coordinator. And they also have been working very closely with Lamont Daniels, our chief of community services. And so they have been supporting a range of needs in the community during this crisis. Our volunteer coordinator, Donna, has also worked with spontaneous volunteers. So we have our emergency response team that have gone through extensive training and meetings, but then there's also the spontaneous volunteer process that Donna has been able to coordinate with Lamont and others. And so there's both of that, and Michelle as well. Some of the highlights, they've been working with person to person to help them pack some food in the food pantry. They've done a lot with delivery and drivers. They've, have teams every weekday going to deliver groceries to, in particular, senior populations, as well as people who are quarantined. And so that's another big piece of that, is to look at, who is under isolation and quarantine and can't get out. And so how can we help provide them with the resources they need? They've also been supporting Lamont with his food access work related to the food drive that was implemented with the Connecticut Food Bank. So working really closely with Lamont and helping him make that happen. They've also been stitching homemade masks, and we've been providing those to those who call us and say they're in need of cloth face coverings. So that's been incredible. They've been doing outreach calls to individuals to figure out if they need referrals or support. They also, they're skilled in a lot of different languages. And so they've been helping us with translation of materials. And they've also helped us with contact tracing and following up on, the positive cases as well. So they've been an incredible resource to us, and I just can't thank them enough for all that they've been doing for us. Another big piece of all of this has been related to enforcement. So I'm sure you're all aware that the governor released his executive order last week, which was related to the reopen guidelines and who would enforce them. And so I'll just talk about my piece, and Chief Kowalik can talk about his. But he's created a public health facility designation. So health directors have the authority to enforce the sector rules related to any of the public health facilities. And so those include the restaurants, all of the personal care services, the tattoo, the nail salons, the hair salons, the barber shops. And so we've been working on, in particular right now, it's been the first phase, which is the indoor dining. And so our inspectors, our sanitarians, have worked very closely with the planning and zoning department and economic and community development and others, as they've been reviewing all of the applications for the outdoor dining, but then also just going out and inspecting and coming up with checklists for all the reopen guidelines and really helping them through this whole process too, because it is a big learning curve, for everyone. And so just really helping them, even if it's just printing out a sign that encourages social distancing, helping them get those resources, and just, helping, just maintaining and monitoring the situation as we move forward. So that's been a big piece related to the enforcement. And we're also getting ready for the hair salons and the barbershops to reopen on June 1st is the date that the governor has set. And then June 20th is the date they're looking at for all the other personal care services. So the tattoos, the nail salons and all those others. So as the governor and the city work through the different phases, we also are, working through all of those. And we continue to do the work that we've always been doing related to housing and all that other work as well. And then our preventable disease division continues to work on the contact tracing. And then we're also working on learning the new system that the state health department has put together. And also thinking about our own pool of resources, both staff and volunteers, to continue to support this work. I do want to mention the public school nurses, and the emergency response team has been helping us, but also the Norwalk public school nurses have been an incredible resource to us. They've been volunteering their own time and dedicating their skills and their knowledge to help us. So that's been also an incredible resource to us. And so, those are the big areas. We continue with the communication and health education and monitoring and managing our website and giving new resources and tools out, helping our community partners with communication and messaging, working really closely with the mayor's office as well on the communication. A big thing for us moving forward is thinking about vaccination. And so we don't have a vaccine yet, but we're planning for it. But the big thing we're planning for now is flu vaccination. So we believe there's going to be high demand for flu vaccine. We really want to push the vaccine as well because, the whole healthcare capacity, the fewer, if we're thinking about if there's going to be a second wave of this, we want to keep as many people out of the hospital as we can. And so we're thinking about flu vaccines, and we're also thinking about a different model for that because what we've done in the past would not be a safe model, having several people in our building at the same time getting vaccinated. So we're thinking about a drive-through model right now. We're planning for that. So those are the big highlights right now of the health department. Thank you, Nick.
Thank you. Any questions for Deanna? Discussion? All right, thank you for the updates. You actually provided phenomenal regular updates. So I think I don't think there's too many surprises there for this group, but for the public, been on top of everything. Thank you for everything you've been doing, and thank you for the presentation this evening. The next one on the list is the emergency management. Michelle, you taking that?
Yep.
Thank you.
Always forget the mute. So just want to touch on a few things. We are still doing our regular EOC calls. So we have some strategic meetings on Thursdays with a lot more of the health providers. But then on a weekly basis for March and April, we've been doing EOC calls, which does bring together pretty much all the departments that are involved. Maybe not directly, but provide indirect support. So they're always maintaining that awareness of what's happening and then some of the conversations back and forth between them. We've now switched for probably May and June. We'll do every other week, really focusing more on the reentry and recovery mode. And then probably for summer, either stick to an every other week or maybe a once a month update. Just again, so everybody does have that opportunity to, again, hear from all the departments directly involved, see who needs what as far as support. And then again, a lot of us have conference calls and regular updates throughout the week. So we are always communicating. A big part really has been for several weeks is providing the PPE, specifically masks, sanitizers, gloves, to our nonprofit partners so they can continue to do the work that they're doing in the community for their residents and clients. And about 5 weeks ago, the state of Connecticut actually launched a small business program for PPE. So starting off with the essential businesses, 50 employees or less. So the first couple of weeks were mask only. Last week or in this coming week, they expanded it to nonprofits, non-essential businesses, houses of worship, plus essential with infrared thermometers and masks. So my office looks like a small distribution center. Last week, we had about 700 small businesses and sites that requested PPE. This week, it's actually dropped down to, I think, about 200. So it's going to be a light week for me. And pretty much they requested during the week, pick everything up on Friday, package it, and then get it out to them for them to pick up the following week. And we just keep doing it. And it is a good way to connect with the businesses, share some of the information, websites where they can go for recovery. It gives them a point of contact. And then also for us, it's a great benefit because we now have an amazing database that we keep growing with emails, addresses, and points of contact. So it definitely will be helpful as we move forward. And again, I do expect that to probably continue at least a few more weeks. And then hopefully it will come to an end. They keep promising me. But again, I think really making sure that as they reopen and have questions, that they do know that they can come back to the city for assistance. Another big piece is the long-term recovery committee. So the governor has been focusing on long-term recovery in each of the 5 planning regions. So we've set up a steering committee. We'll set up some working groups, and hopefully that will continue through the next few months, if not longer, and look at some of the resources, the unmet needs, and what additional assistance we can provide, again, both to residents and to the businesses impacted. So again, that will, as with a natural disaster, the long-term recovery can often go months or years beyond the actual response. And then again, for me as a weather geek, hurricane season starts June 1st. So as we go into summer mode with extreme heat and then also hurricane preparedness, we'll keep focusing on COVID, but then also look at what the impact of COVID is on some of our normal sheltering operations. So for example, if we do have a big storm, we can't necessarily get 400 people in Brian McMahon High School. So it's really making us look as a municipality and then as a region, how we change some of our disaster response to natural disasters in light of the pandemic. So that's it.
Thank you. Any questions for Ms. DeLuca? For those of you who don't know, Michelle does a lot behind the scenes. So she's been orchestrating and coordinating a ton from the very beginning, and she's been facilitating communication between all the departments. So she's been on a lot of the heavy lifting, especially in the earlier stages when we were kind of in somewhat of a disarray. So Michelle, thank you for everything you've been doing from all of us.
Thank you.
Absolutely. And let's move forward to the next update from the fire department. Who would like to take that? Chief Gatto, do you want to take that, or Deputy Chief?
I'm here.
How are you,
I
sir?
just want to echo also that Michelle's been doing a tremendous job. She has been answering every email, every phone call, every whatever kind of communication. Everything emergency management directed goes to Michelle. So not only that, but she's also doing the state region 1 work for mass care as well as the long-term recovery. So she's doing a great job. Thank you, Michelle. So I want to just get into a little bit about what our response was to this whole COVID pandemic. Michelle's also part of my senior staff, and from the very beginning, we have been proactive during this whole virus. And one of my major concerns
Chief, we lost you.
personnel health and safety. From the very beginning, Oh, I can hear you.
Mm.
Can you hear
Try-
me?
Yeah, maybe shut off your video. I think you're freezing up a little bit. Sometimes that helps.
How's that?
Clean.
Better?
Excellent.
Clean?
Yeah, much
Okay.
better.
Do I have to start all over?
Does the
I'll
group?
just pick up. In other words, so from the beginning, we started to acquire as much PPE equipment as we could, because we were hearing all these stories that everybody's running out of masks and gloves and things like that. So Chief King has been doing a great job in acquiring as much equipment as we can. This is before the state was able to get some of the strategic stockpile equipment and hand it over to us. We took our operations plan and we modified it completely for COVID-19, which is an 8-page document. It's 7 major categories. So it's changes to our daily routine operations, changes to routine emergency responses, what actually determines what type of PPE you put on, the procedures for interaction with known or suspected infected persons, hygiene and safety, staff fitness for duty, and decontamination. If you want, I can go through every single one of these, or just tell you that the fire department has only had 1 positive case. And I think all the precautions that we have in place now, we've been modifying this operation plan several times as the CDC changes or as Deanna tells me something differently. From the beginning, she can tell you we had many conversations about who should go home, who should stay, who's got a quarantine. So thank God all that has settled down. So do you want me to go through all these different categories?
I'll ask the committee. Did you want to ask specific questions of the chief, or do you prefer he goes through it all? I think it's okay if we ask specific questions of him. Is that okay for the group?
Sure.
All right. Chief, would you like to open it to the questions now, or did you have anything else that you wanted to
No, you
touch
can
on?
do the questions.
Outstanding. Is there any questions from the committee? All right.
Getting off easy.
Yeah, a lot of this is new information, and it takes a bit to absorb, and we probably will have questions by tomorrow. But thank you for everything that you've put together for this. I guess if there's no additional questions, Chief, thank you for your presentation, and we'll move to police. Chief Kollick.
Hi, good evening, everybody. I'm not going to repeat everything that was been already said. A lot of it applies to us as well, but just as an overview, just basically we've been just following best practices, which have been changing almost daily. And as they change, we've been changing our approach, both with the officers and also with combined dispatch. I do want to make a mention, they're not part of this conversation, but Norwalk EMS has done a tremendous job. And I know the fire department would agree that they've taken the brunt of the COVID calls. They've protected the officers and the firefighters from having to be exposed unnecessarily. So we got to give them kudos. They've been great to work with, and they've done a tremendous job. As a result of the pandemic, though, our call volume has dropped dramatically, or had dropped dramatically for the last 2.5 months, right across the board. It's starting to pick up a little bit now as the weather is improving and people are out and about. As you've noticed today, I noticed traffic picked up quite a bit today compared to what it's been the last couple months. And I think that's going to continue. I think people are starting to get antsy, and with the weather improving. Similar to the fire department, the COVID virus had little impact on our staffing, which has been a little surprising. Some departments got hit much harder. We did not. At the outset, most of our civilian staff has worked remotely. We were able to obtain about 12 laptops, which were programmed by IT, and our records unit is working remotely. Our payroll, purchasing, pretty much all essential services for us, but not public services, have been operating remotely. And that's kept them out of the building. So the building basically has just been a very skeleton staff of civilians, aside from dispatch, and then our officers. And even in our specialized units, we've been staggering hours there so that if someone did come down with the virus, it wasn't passed on. And thankfully that's worked. As Chief Gatto said, we had no issues with our PPE supplies. We were very fortunate to get, we had some, but we also got a lot donated. And also from the state. As you know, you approved, I believe, last council meeting, or the one, not yesterday, but the previous, a federal grant that was obtained for police, which is paying for most of those laptops, most of the things that we had to put into place. So you won't see a lot of expenses from the police department in that COVID account, so to speak, that's being put together for the city. We'll be getting reimbursed for a lot of that. The biggest issue we're facing right now is the enforcement. As Nick said, we're starting to get calls about social distancing, people not wearing masks, including some police officers at times. And a lot of that comes down to, unfortunately, some civilians don't understand what the rules are. And that if you're outside of 6 feet, you do not have to wear a mask. If you're inside 6 feet in public, you do have to wear a mask. Some don't understand when you do, when you don't. One thing that's concerned me a lot is, and if it's not just us, but you know, in my tenure here, not just as the chief, but even as deputy chief, our community relationships has been one of the focus points that I've been really trying to impress on the officers and also on our staff. And I'm afraid that we're losing a lot of that community involvement and community policing mentality because of the police seem to be only involved now in enforcing violations, so to speak. We're trying to do some other things, but because of social distancing and other restrictions, we're not able to be out there mingling like we used to. And I'm hoping that we don't take a big step back in that regard as time goes on and the longer this continues. Education, I think, is still the biggest issue, is still educating the public on the do's and don'ts of what's required, and also when to call the police, when to call the health department, who enforces what. You know, I don't expect them to understand all of that because we don't even understand a lot of it, and that's changed at times too. I'd say the biggest thing that I took from all of this, and I wasn't surprised, is the cooperation among all the department heads in the city. I've been impressed since I became chief, and even with a lot of the newer people that have come on in the past year to 3 or 4 years. Everybody is very cooperative. We meet, I don't know how many times a week on phone calls or whatever. Everybody's willing to work together. And I think that's what makes Norwalk very different than some other municipalities, is that we got a really good group of people. And we all get along as well, as far as I can tell. So that's also a nice thing. So I have to say that it's gone much better than I expected and that we expected, at least in the police department. So with that, I'll take any questions anyone has.
Thank you. Ms. Shanahan? You're muted.
I know, it takes so long to get unmuted. Chief, I just wanted to reassure you a little bit, and also thank you. We had a lot of calls when this first started down in District D, especially along the water. Big crowds of people going down, people playing basketball. We had lots of concerns, but your community officers came down and did a really lovely job of kindly talking to people about making a difference. And they've been very good about coming down on the weekends when it's high tide, and we once again get lots of crowds. So I do want to reassure you that they've been making a good impression with our community, and I really thank you for the concerns that the people in town had with these big groups. So they've done a great job for us. Thank you.
I appreciate it. And I think the big thing we're trying to instill, not only on the public, but on the officers themselves, is just use common sense. We don't want to be heavy-handed. We're hoping to get compliance. We're very limited in what we can do. The only enforcement that we can do is to actually make an arrest, which is a misdemeanor, which we don't want to do. I wish there was other things we could, but it's either warn people or arrest them. And there's not a lot in between. So we've really shied away from, the heavy-handed approach. And so far it's worked. We're hoping that continues, and the public's been cooperative. So
I think sometimes just your presence alone is enough for people to realize what they're doing and perhaps leave big groups. Thank you.
Yep.
Thank you. Any other questions for Chief? Chief, I wanted to actually thank you for remembering to bring up the EMS team. That was a big deal, and I know that they did bear brunt of this. So thank you for acknowledging that. If there's no other questions, Mrs. Johnson, I'm sorry.
No, it's all good. Thanks, Nick. It just came up because I've been hearing from some small business owners, Chief, that there's a minority, small minority, but some folks that go into stores refuse to abide by that particular store's decision to require them to wear masks inside. So what would you suggest small business owners do if they encounter customers that are refusing to comply with what the store has decided to do to keep folks safe? Is there anything we can tell them?
Yeah, well, there's two things I would say is one, I think people have to remember that although the governor's order is to wear masks, if someone feels that because of a medical issue that they should not be wearing it because it would be a negative impact on their medical condition, that they don't have to, and they don't have to prove that they have that. So it's a fine line, but as a private business, obviously they can make rules to limit to whomever they don't want to serve if they don't want to follow whatever protocols are in place. So if they choose to not allow someone in the store because of whatever reason, they're not dressed appropriately, or they're not wearing a mask, or not practicing social distancing as they require in the stores, obviously they can ask them to leave. If they don't leave, then the other alternative is to call the police and have an officer come out and then request them to leave. And if they don't, they could be cited for trespassing. Hopefully, again, that's not the case, but that would be the last straw, so to speak, if they just could not get cooperation.
Thanks very much, Chief. I appreciate it. Thanks for everything you all have been doing. Fire, EMS, and police.
Yeah, thank you all. Any additional questions? Okay, thank you all for the presentations today. We did get some outreach from the public for a more formalized committee meeting to have this level of outreach, this level of updates. So we do appreciate you putting this together and putting some time, as busy as you've all been. We will hopefully try to keep a standard cadence going forward of the committee meetings. This is more for the committee members themselves. We did cancel quite a few just because of what was going on and the staff that was involved being so busy through that time. But we do want to try to get it back to a regular cadence, try to meet more on a monthly basis. And if you have anything that you'd like to request beyond those future agendas, or if you want any specific updates, we could kind of target it and be a little bit more focal and centralized as opposed to broad like this. Or if this update was useful, these are recorded. It will be distributed to the public as requested. So I'm very grateful to have everyone here. So again, thank you all who have presented tonight. And if there's no further questions, do we have a motion?
I'll move.
All right, motion to adjourn. All in favor? Unanimous. Thank you all again. Have a great evening.
Great.
Thank
Thanks,
you very
everybody.
much.
Thank you for all your work.
Thank you all so much.
Welcome.
Be well.
Night, everybody.
Have a good night. Be healthy,
Have a
everyone.
good night.